Hello everyone, I would like to welcome you all in today's Global Edu-Conclave 2021. I am very glad to be a part of it, and thank you all the organizers for inviting me as a keynote speaker here. Today I will be talking about good health and well-being. Hi, I'm SRICHETA PARUI. I am a fellow life member of I2O organization, also life member of Green Thinker Society, and I have done my master's in control system engineering from Electrical Engineering Department of Jadavpur University. Also, I'm a researcher, YouTuber, and public speaker. So let's begin the talk today. Today I will be talking about the challenges for good health and well-being. Why is this important? How we can address this thing? The facts and data, what progress we have made so far, what I am doing, and then conclusions. Okay, so let's talk about the challenges we can face. So poor health constitutes suffering and deprivation of the most fundamental kind. We all know during this situation, this COVID situation, we all can understand how much this healthcare system is important and how much important is your health. So despite the global progress, an increasing proportion of child death occurs in sub-Saharan Africa and Southern Asia, even in India also. Due to the malnutrition, so many children are suffering. Globally, the incidence of the major infection disease has declined since 2000. It's a good news, including HIV, AIDS, malaria, TB. But the challenge of these and new pandemics remain in many regions of the world. This corona pandemic, even in our country also. So immense progress globally in finding newer treatments, new vaccines and technologies for healthcare. But universal, affordable access to healthcare remain a challenge, right? Because there are so many vaccines that are available in all over the world, but how many people can afford them? So that's a challenge. It should be affordable to everyone, and everyone should have the access of the vaccines. So now comes, why is this important? First of all, we all know that disease burdens family and public resources. Due to this lockdown also, it affects our society a lot more. So many people have got jobless, and it also weakens the societies. It also squanders the potential. So this is why this good health is very much important. The next thing comes, how can we address this thing? The global effort to eradicate this disease, strengthening the treatment and the healthcare, which is very much important. Very few percentage of our taxes are reserved for the healthcare system. It should be increased. Then we should address new and emerging health issues, because if you don't know the issues, how will you take measures? Then comes innovation and research. We have to invest more and more money, more intelligence towards innovation and research. We should give more importance to the scientist rather than a film star. How many of you are waiting for a film in a year rather than a hospital in a year? So yes, you should think about it. Also, we should enhance the public policy efforts. So these are the ways how we can address this thing. The next thing comes, the facts and data available. So, okay, let's first talk about the holistic approach to better health. So holistic approach to better health requires ensuring universal access to healthcare and to making medicine and vaccine affordable, what I have said already. It also calls for a renewed focus on mental health issues. Mental health issues is very much important. As you can see that suicide is the second leading cause of death globally between the ages of 19 to 25. Because this age gap is very much vulnerable. In this age gap, we actually don't know what is wrong, what is right. So that is why suicide became the topmost position, got the topmost position as a cause of death. It should not be happened. I would request to all of you, judge a little less and listen a little more. Spread your hands and listen to the due words. And also, this health and well-being are closely linked with the equality of our environment. If you're surrounded with the friends, if you're surrounded with your family, you will feel better, right? So always try to be there for someone. Make them smile for you. So that is actually that will feel, you will feel better in that way. Next comes the facts and data. The child's health is very much important. In 2018, an estimated 6.2 million children and adolescents under the age of 15 years died, mostly from preventable causes. Of this date, 5.3 million occurred in the first 5 years, with almost half of this in the first month of life. Despite determined global progress, an increasing proportion of child deaths are in sub-Saharan Africa and Southern Asia. 4 out of every 5 deaths of children under 5 occur in these regions. Children in sub-Saharan Africa are more than 15 times more likely to die before the age of 5 than children in high-income countries. So we need to focus on these developing countries. Malnourished children, particularly those with severe acute malnutrition, have a higher risk of death from common childhood illness such as diarrhea, pneumonia, malaria. Nutrition-related factors contribute to about 45% of deaths in children under 5 years of age. So you can understand that how much the child's health is important. And what comes with the child's health? The maternal health. You can see from the data, over 40% of all countries have fewer than 10 medical doctors for 10,000 people, which is very poor. Over 55% of countries have fewer than 40 nursing and midwifery personnel per 10,000 people. Is it feasible? Do you think that? No. In Eastern Asia, Northern Africa, and Southern Asia, maternal mortality has declined by around 2/3. That's a very good news, obviously. Every day in 2017, approximately 810 women died from preventable causes related to pregnancy and childbirth. 94% of all maternal deaths occur in low and lower middle income countries because we don't take care of our women, right? So that's why these things happens. Young adolescents ages from 10 to 14 face a higher risk of complications and death as a result of pregnancy than other women. But maternal mortality ratio, the proportion of mothers that do not survive childbirth compared to those who do in developing regions, is still 14 times higher than in developed regions. That is the bad news, and you have to take care of that. Then comes from the maternal health is HIV, malaria, and other diseases like TB. So from the facts and data, it's pretty much shocking to know that 38 million people globally were living with HIV in 2019. And in 2020, I'm pretty much sure that this number has been increased a lot. 25.4 million people were accessing antiretroviral therapy in 2019. 1.7 million people become newly infected with HIV in 2019. 690,000 people died from AIDS-related illness in 2019. 75.7 million people have become infected with HIV since the start of the epidemic. Tuberculosis remains the leading cause of death among people living with HIV, accounting for around 1 in 3 AIDS-related deaths. Globally, adolescents, girls, and young women face gender-based inequalities, exclusion, discrimination, and violence, which put them at increased risk of acquiring HIV. Yes, rape is also a cause of this thing. HIV is the leading cause of death for women of reproductive age worldwide. AIDS is now the leading cause of death among adolescents aged from 10 to 19 in Africa and the second most common cause of death among adolescents globally. It's unfortunate, really, really unfortunate. But still we have made some progress, We are trying to make progress. But how much? Let's talk about it. So what progress have we made so far? Major progress has been made in several areas, including in child and maternal health, as well as in addressing HIV, AIDS, malaria, and other diseases. Maternal mortality has fallen by almost 50% since 1990. Measles vaccine have averted nearly 15.6 million deaths since 2000, and 13.6 million people had accessed the antiretroviral therapy by the end of 2014. Yes, that's a very good news. And let's talk about India and Goal 3. So India had made some progress in reducing its under 5 mortality rate, which declined from 125 per 1,000 live births in 1990 to 1991 to 50 per 1,000 live births in 2015-16. And its maternal mortality rate, which declined from 2 to 212 per 1 lakh live births in 2007-9 to 167 in 2013. India has also made significant strides in reducing the prevalence of HIV and AIDS across different types of high-risk categories, with adult prevalence reducing from 0.45% in 2002 to 0.27% in 2011. However, a quarter of global TB cases occur in India, where nearly 2.1 million people live with the disease, and an estimated 4,23,000 die annually as a result. The Indian government's National Health Mission priorities national well-being and is leading changes in this area, in addition to targeted national programs against HIV, AIDS, and sexually transmitted diseases. So we are still progressing, right? We need progress. So what I am doing what's my contribution towards this goal? I am actually studying neuroscience and doing research on neurodevelopmental disorder. I'm trying to predict the disorder in a pretty much earlier stage so that we can take action against it, and we start medications to the patients and the patient lead to a normal life. So also it helps to reduce the mental health issues. I'm also working with the psychology. We are making some model which actually helps in early detection of neurological disorder and treatment. The research is going on autism spectrum disorder, ADHD, AUD, epilepsy, Parkinson, Asperger's, dyslexia, especially the disease which happens in children. We are trying to predict that, and we are trying to make a feedback system also so that it can be cured. So this is my contribution. Also, if you want to contribute, you may ask that what I can do. So what you can do? You can start by promoting and protecting your own health by wearing mask, by washing your hands, and you should get vaccinated wherever possible. And the health of those around you, your dear ones, your loved ones, by making well-informed choices, practicing safe sex, and vaccinating your children. You can raise awareness in your community about the importance of good health, healthy lifestyles, as well as people's right to quality healthcare service. Come on, let's talk about it. Let's ask someone about it. That what are you thinking about it? So if you don't talk with each other, then no solution will come out. Then you should take action through schools, clubs, teams, and organizations to promote better health for all. We should increase the awareness among those who don't understand, especially for the most vulnerable, such as women and children. You can also hold your government, local leaders, and other decision makers, maybe a public figure, accountable for their commitments to improve people's access to health and healthcare. So if you want to make progress or want to connect with me, the website is given, the email ID, my email ID is also given, my LinkedIn ID is also given. You can connect with me anytime. If you want to do progress, you can contact with me. If you want to contribute in good health and healthcare system, you are always welcome. So that's all from my side. Thank you, all of you, for giving me this opportunity to share my views on it. And I request all of you, please take care of yourself, please take care of your dear ones, and stay healthy, stay safe, wear the mask, get vaccinated, and wash your hands, and please maintain social distance, because we are still fighting with this virus and have to win. Thank you so much. Bye-bye.